Hey guys, so I wanted to come on and do a quick video. I actually did a TikTok on this a couple days ago. No, maybe like a week ago. And I was like, you know what? I need to come on here and do a YouTube video about this. So, what I want to talk to you all today, and I'm going to try to be quick. Um, and I haven't prepared for it or anything, so it probably will be quick. But I want to talk to you all today about giving report. So, I was scrolling on Facebook one day and probably a couple weeks ago, and the status said, and he's a nurse, he works at the VA, and the status said there's not that much report in the world. Like, give your report and get on. Like, come on. Like, there's no need for us to be in report for 2 hours talking about a patient. Like, give report and go on so that I can get report next, because sometimes nurses have to give report to two or three different nurses just because of the way they have to split the patients up, or we have more than one patient that we have to talk about, and so I kind of need you to get through the first so that we can get to the second, whatever it may be, whatever the situation is. Like, there's not that much report in the world. Like, let's give report and let's move on so that I can get my day or my night started. And usually I find posts like that really funny. Like, usually that would make me like crack up, and I'd be like, yeah, he's so right. But I just was like, he is so right. Like, I didn't even laugh, like, because it wasn't funny to me, because report can just really be I don't even know what word to use. It can just really be a stressful time. It can be a stressful time. It can be an annoying time. Like, because with some people, when it's time to give a report, you're just like, I don't know if I can do this. Like, it really takes prayer to get through report. And so I just wanted to come on and I just wanted to give you some tips on if you're giving reports and if you're receiving report. So in my TikTok video, I mentioned that I really feel like giving report on med surge was really different from giving report on the ICU. And when I went back and looked at the video, I was like, that might really come off as offensive to someone that's a med surge nurse. And because I said that it just was different in the sense of, one way of it being that I didn't feel like I had to give a really long report when I worked on the ICU unit, because I just felt like the nurses were a little bit more on their crap and they didn't need a 20-hour report. And that wasn't to down a med surge nurse, because I think I think nurses in general are awesome. And I think it definitely takes a special person to be on a med surge floor. And if you've worked on a med surge floor, that I am definitely correct, that you have to be a special person. So I didn't mean any offense, but I did find that giving report on a med surg unit, that just the majority of those nurses wanted a very detailed, laid out report. They wanted a lot of information. They were usually the ones that asked me a lot of follow-up questions, a lot of questions in general. And now that I'm saying that, it really could be for different reasons, because when you have 6 patients versus 2 or 3 patients, which is what you have more so in the ICU, and on med surg floor you had 6 when I worked in the hospital. So you may not have time to go through 6 people's charts. So you may ask a million questions, because you just may not want to take the time to go through 6 people's charts and get all the information, or you just may feel like you don't have time to do that, which if you work day shift, you probably will not have the time to like thoroughly go through 6 people's charts. But and so that's how I found that giving report was on a med surg unit. And then when I got to ICU, the dynamic was so interesting, because the nurses that had been there for like a really long time, like, they would get annoyed with you when you gave a really long report. Like, I'm telling you, and I don't know if I just worked with some rough nurses when I got to the ICU or what, but they would literally, like, if you started talking too long, they would lose interest. Like, they would start talking to other people. They were so disrespectful. I love them though. Like, especially like when you're new, like, because it's like you have to work your way up. Like, nurses really do eat their young. Like, and this is just with certain people. This wasn't everybody on the unit, but I don't know, like, sometimes they would just be really rude. Like, you would be giving a report and they would like anyway, like basically like anyway. And then yeah, and then I remember there was one nurse, like her motto was, and this is, and I think she's a big reason why I became the way I was. Like she just be like, I figured it out. Like she might ask me a question and I didn't know, and she'd be like, that's fine, I'll figure it out. And honestly, y'all, like that became my motto. Like I just was like, you know what, I'll figure it out. And I got to the point where I would ask questions, but they would be like vital questions, and yeah, like vital questions. And they would be like short and simple and to the point. It wouldn't be a question that required you to go in depth for 30 hours about it. Like it would just be a short, simple, to the point question. So, um, but yeah, now that I think about it, like they were really ruthless in the ICU. And like I said, they got better like the longer I was there. But they just didn't want a 10-hour report. They wanted you to get to the point. They wanted you to hit the highlights. And honestly, like I think that that's what you should do. I think that you should stick with the factual information, you know, the name, the age, date of birth, maybe. I don't even know if I would put that in there. What they're in there for, what procedures they've had, what drips they have going, what who their doctors um, are they on any crucial medications that I need to know about? Um, have they had outrageous blood pressures? Have they had outrageous heart rates? Are they in what rhythm are they in? Um, is their family cuckoo? Um, do they have diarrhea? Is their urine output okay? Of course, when you get into, if they're on the ventilator, you get into vent settings. Are they on any oxygen? And mind you, I'm giving the things that I'm just saying, those that's vital information. Like I need to know if they haven't had any output all day. And I need to know too if you've said something to the doctor. Like have they not peed for 12 hours and you haven't said anything, or you haven't done a bladder scan. So if you tell me they've had no output for the day, what have you done? I need to know. And one of those things needs to be that you have at least done a bladder scan and at least told somebody. Bowel movements, like I said, and kind of with diarrhea, trying to think, is there anything else like, but basically you're smart, you're a nurse, you're smart, you know what vital information and important information I need to know about my patient. Let's cut out all this extra stuff that is not important. I don't need to know if they have SCDs on. I don't need to know if oh, I do need to know about their mental status. Are they awake? Are they oriented? But I mean, stuff that's not relevant. You know when you're rambling. You know when there's stuff that you can just move past. Like when you're giving report, I need you to just give the vital information, and then I need you to move on. And I need you to move on in the sense of moving on to the next patient, or moving on and giving report to the next nurse. Because as we know, change of shift is a really busy time. And I need to get my night started. I need to get my day started. So just hit the high points. You don't have to tell me everything about the patient. Now, I would be knowledgeable about the patient, and if certain questions come up, I would be ready and prepared to answer them. But everything doesn't have to go in report. And so I just really want to emphasize that, because I learned the hard way, because that is it does something to you mentally when you're giving a report and people start talking to somebody else, or people start just lose interest. And some of the time it is because you're giving a super long report, and sometimes it's just that person is a butthole. But either way, don't take it personally. And I know that can be difficult. Don't take it personally, but like I said, if you give a good and thorough concise and thorough report, then you've done your part. And if they have any questions about it, they'll follow up with you. They'll ask you a question. And so I will say that when you're receiving report, don't be that nurse, especially if you've only got two patients. Like, you will have to, unless they are just like the craziest, busiest patients in the world, like you will have to, oh, labs, that's something else. Critical labs, like if they have a potassium of 7 or 8, like I need to know that. And I need to know that you've called that in. Like, there's some stuff, guys, like we've got to tighten up on as nurses. Like, if there's crazy, if there's crazy lab work, like you need to follow up on that with the doctor. Like, I shouldn't get to day shift or night shift and you haven't done that. Like, and that's kind of what I was saying about the urine output, that don't put that on somebody else. If they haven't used the restroom the whole shift, you haven't done a bladder scan, you haven't given two flying flips about it, but then when I get there, now I've got to do everything. So yeah, all that is vital information, and you need to have acted upon it, because that would drive me nuts too. So I will say that when you're receiving report, stop asking a million questions, especially if you know you're going to have time to get in the chart and actually go through the information. Like, when you have questions, make sure that they are vital questions, and that they're questions that actually make a difference. Like, again, do they have SCDs on? That's something you can just go in the room and see yourself. Like, that's just something you can do yourself. Like, I'm trying to think of other things. It's been a while since I've given report and I've received report, so I'm trying to kind of think. But you're intelligent, you're smart, questions that are vital, that you need to ask, and questions that you can just flip through the charts yourself and find them, because that holds report up too. When you're receiving report and you're asking a million questions, So, and always, too, when I was in nursing school, we used to always be told to lay eyes on the patient together, and to go in after you get report, to go into the room together and look at the patient. Honestly, like when I worked in the main hospital that I worked in for all those years, for like 3 years, we never did that. Well, we kind of did it in med surge, but when I did it in the ICU, we didn't do it as much, because in the ICU, you can usually see your client or patient. You're usually looking dead at them. And then when I worked in a heart hospital where it was just all heart patients, they were really strict, and every hospital is going to be different, but they were really strict about us actually going into the room and looking at the patient and, making sure that the report that was given was accurate. And the only reason why I'm just like, about that, and again, it's going to depend on the hospital you work at, because some hospitals are very strict about that. But the only thing about that is, what am I gonna do if I go in there and what you told me and what in the report I was given is not the same? It's like, I don't know. Because I mean, how many? And that's another reason why, y'all, I just kind of, over time, I just lost interest in report, because I had gotten so many bad reports, and so many just got report, and then when I actually went into the room, it was something completely different, or it was a total mess. I mean, stuff everywhere, lines all over the place, the patient's a mess. And it's just like, at that point, what am I gonna do? Make you stay and help me do it? Like, I don't even want you in my presence at this point. So you might as well leave and go on. So I guess it's kind of like a personal preference. But if you do want to go in there with the nurse and be like, just confirm that the report that was given, or even doing report at the bedside, I guess you could really just do that, then that's fine. I think that's a personal preference. For me, it didn't really make that big of a difference. But for other people, like, it may, because my mindset was, I'm going to have to figure it out by myself anyway. Like, So, but yeah, that kind of became my motto, that I was respectful during report. Like, I always listened. Now, I would sometimes, if you going on and on about nothing, I would kind of try to give you signs that you're losing me. and that you need to, wrap it up, wrap it up. But overall, I was respectful, but I didn't really ask a lot of questions, because my mindset was just that I'm gonna figure it out. Like, I'm gonna figure it out. And honestly, guys, that should be your motto as well. That, I'm gonna figure this out. I'm gonna get through this. This might be a crazy shift, but it's gonna be a good shift. It's gonna be a good day. It's gonna be a good night. And I'm gonna have help. I'm gonna get through this. Like, I'm gonna figure it out. Like, it will be okay. So that's honestly got to be your mindset as well, because like I said, you're gonna get trash reports. You're gonna get reports that you're just gonna be like, what in the world? Like, they didn't know anything that they were telling me. And honestly, that's just how the game is, when you get into nursing. So yeah, so just hopefully these tips helped. I tried to keep this video short, but yeah, have a great day, and hopefully I will have another a better topic to talk about next time. I think this is a good topic, but hopefully I'll have a topic that if y'all have topics you want to hear about, let me know. But hopefully this helps, and just remember what I said.